Okay, so the next underlying root cause of chronic lower back pain that I'm going to talk to you about today involves an area of the body that I find that so many people just seem to ignore or just have no idea about how important of a role that this part of the body plays in terms of overall spine health. But at the same time, this is a problem that is so common. We see this problem almost every single day, especially for people who struggle with poor posture or who have to sit at a desk all day long. But most importantly, that this is a problem that can be easily fixed. But the thing is, as we've said before, the reason why most people struggle with chronic lower back pain is because they stay stuck just trying to fix the symptoms in their lower back and do not realize that the majority of their problems could actually be coming from a combination of stiffness and weakness that develops in their mid to upper back region, which is also known as the thoracic spine. So in this video, I'm going to teach you about some of the basic mechanics of this thoracic spine area. And then from there, I'll share with you how stiffness and weakness of this thoracic spine causes your lower back to hurt. And then from there, most importantly, we'll share with you a couple of simple self-tests that you can perform to see if these are the problems that you actually have. And then from there, we'll show you a couple of very simple exercises that you can do to try to fix some of these problems as well. So what is the thoracic spine? So the thoracic spine is an area of the body that comprises of the 12 vertebrae that sit just below your neck, which is known as the cervical spine, and it also sits above the 5 vertebrae of the lower back, which is also known as the lumbar spine. And it is this thoracic area where the majority of the twisting and bending of the spine is going to occur because it's the area that has the most amount of vertebrae, but it is also the part of the body that has been the most greatly impacted by modern technology and just kind of how people live nowadays. People just kind of staring at their phones or staring at their tablets or having to sit or work in front of a computer for hours every single day, where their shoulders and upper back are always kind of stuck in this, slouch or slump posture for again hours or days or weeks or months or years. But the problem is most people just do not realize how this lifestyle is actually affecting their body until they start to actually feel some form of lower back pain that just kind of pops up out of nowhere, and not realizing that it could be due to the problems that are occurring within this mid-back region. So how exactly do problems in this thoracic spine region actually cause and contribute to causing lower back pain? So there are two main reasons. The first one being the stiffness and immobility of the vertebrae, followed by the weakness that develops within these muscles as well. So what exactly do I mean by stiffness and immobility? Well, it's just I find that a lot of the people that we work with are just completely unaware of the simple fact that the spine is designed to be able to move. So let me show you, right? So if I take the spine here, right, as you can see, if I take this, I can bend it, I can twist it, I can move this thing every which way. And as you can see here with my own body, that I can do the same thing as well. I can bend, I can bend backwards, I can twist, I can reach, I can do all these sorts of things because this is something that I work on, and mobility of the spine is something that I possess. And again, the main point I want to stress here is that your spine is designed to be able to move, but the problem is if I don't consistently move or stretch or work on maintaining its mobility, and if I instead just kind of stay stuck at a desk for several hours a day, every day, every single week for again months or years, that what's going to happen is you will actually start to lose the ability to create movement within this area, because the muscles and the joints and just the overall physiology of your body is going to slowly adapt to your environment and adapt to the things that you do. And if your environment and the things you do just consist of just kind of sitting and slumping and slouching with bad posture, then again, this is going to lead to having a significant loss of range of motion of these vertebrae, and this is going to cause problems within your spine. Particularly in the lower back, because if I'm sitting in this position where my upper back is stuck forward, and if I do not have the ability to create, better alignment of my back, then the second I stand up, this is going to cause my entire body to just be kind of pulled forward. And in order for me to stand up, again, if I do not correct or create the motion in my mid back where I'm supposed to create it, then what's going to happen is I will have to overcompensate from my lower back in order to get upright. And this is one of the most common mechanisms that leads to this, chronic pressure or stress, or just a lot of pressure that's going to build up in the lower back, which can lead to pain and inflammation down the line. Now, the second problem that we want to help you address is the weakness that develops within the muscles that surround your thoracic vertebrae as well. Now, another thing that a lot of our patients do not realize is that there are literally thousands of tiny little muscles that run between each and every one of your vertebrae that go up and down your spine. And these are a group of muscles that are known as the transversal spinalis muscle groups. And the role of these muscles is to essentially control what happens between each and every one of your vertebrae. Similar to my bicep muscle is the muscle that controls my elbow's ability to be able to bend and flex. So if I want to be able to twist or bend or move my spine into different positions, then it is the role of these muscles that are going to help create and facilitate that motion. And another thing that these muscles are also responsible for is to help maintain the upright posture and alignment of your spine as well. But the thing is, since these muscles are so small and that there are so many of them, most people aren't even aware that these muscles even exist in the first place, which also means that most people aren't aware of how weak these muscles have become over time. Because another thing that you need to realize is that when your back is in this kind of forward bend or kyphosis position, is that because of the angle and position of the vertebrae, since these muscles are so small, that it is physically impossible for these muscles to be able to generate the line of pull in order to help you get your back upright. And if these muscles aren't in a position where they're able to work or they're able to contract, then they will start to get very weak and they will start to atrophy over time, because if you don't use these muscles, you'll lose them. And because of the fact that if you do not have the functionality of these muscles to be able to create motion within the spine or to help you create proper posture and alignment, then yet again you will have to overcompensate through the muscles of your lower back, which is what's going to cause your lower back muscles to be so tight and tired and so fatigued all the time, because they just aren't getting any help from any of the vertebrae above. Okay. So what we want to do next within this module is to show you a couple of very simple self-assessments that you can perform to check to see, which areas of the thoracic spine actually might be stiff. And then we'll show you some ways to help you restore that mobility, on top of showing you some of our favorite ways to help you strengthen these muscles as well, which will not only help you take a ton of stress and pressure off of your lower back, but will also help you restore the overall function of your spine and your body as well. Okay, so with us today is my wife Twee, and she's going to be helping us through some of the demonstrations and exercises for today. All right. Now, the first thing that we want to do is to show you a very simple self-assessment to check to see how well or how stiff you may be in terms of creating extension, or also known as backward bending across the middle part of your back, known as the thoracic spine. All right. So the easiest way to do this is to start by using this device known as a foam roller. And what she's going to do is she's going to start by laying on the foam roller crossways, kind of like a T. And she's going to start by just kind of placing the roller right between her shoulder blades, like so. And from there, what she wants to do is to try to bend backwards over the roller, to actually try to touch her head all the way down towards the floor. Okay. Now, Twee here, she is quite flexible. She is quite mobile. So as you can see, she's able to touch her head all the way to the floor with relative ease. And this is what we would call a passing test, which means that, she has good motion and mobility within this middle part of your back. And if you're able to do this, that means that thoracic stiffness or immobility within this area is just not one of your problems that you should be dealing with. Okay. So Twee, go ahead and reset. Now, for people who are tight or who are stiff within this middle part of the back, when they try to bend backwards, usually it will look something like this. So as they try to bend backwards, they actually might start to get stuck right around here, or sometimes a little bit further, and their back just cannot seem to budge past this range. And that is indicative of the fact that they are stiff, or they lack the joint mobility within these vertebrae that could be contributing to and causing lower back pain, like we discussed within the introduction. Okay, now to go ahead and reset. Now, as we talked about before, there are 12 segments within this middle part of the back, and this is an assessment, I would say, for the middle four vertebrae. So once you have assessed the first or the middle four, then we just want to teach you how to kind of slide the roller up your back towards your neck, like so, just so that we can target these first four vertebrae. And then from there, we want to perform the same test. So Twee, go ahead and demonstrate. So if you are, again, able to touch your head all the way to the floor, like Twee here, that means that you have adequate motion within these vertebrae, which means that this isn't an issue that you need to be worrying about. So again, come back up. But if you are very stiff or if you are very tight within this area, it'll might look something like this. Whereas you try to bend backwards, you just might get really stuck. You might start to get stiff, and there just isn't a lot of motion within this area. All right. So after you have assessed now the T1 to T4 or this upper region, now we just want to have you assess the bottom four vertebrae. So Tweed, go ahead and go down your back a little bit, right about there. So just a little bit lower than the segment that you started on the first place. And again, just try to bend back as far over the roller as you can, and try to touch your head to the floor. Again, if you can touch, that means that is a passing test. Go ahead and come back up. But again, if you do start to get stuck, or if you start to feel a lot of tightness or resistance along the way, that just means that you probably have some tightness or some stiffness that needs to be resolved. But again, these are good things because we can fix these problems, and this is what this whole module is about. All right. Okay, so that is it for the self-assessment to check for thoracic extension. Now let's show you some very simple and easy ways to help you correct some of these problems if you have found them in your testing. Okay, so now that we have shown you how to assess for stiffness within this mid-back area, now we want to show you some of our favorite ways to help you increase the mobility within this part of your back, all right? So what we're going to do is just kind of start right on the foam roller, just how we perform the testing exercise. And the reason why we love this foam roller so much is because it's one of the best ways to not only test to see how tight you actually are, it's also one of the easiest ways to help you, regain some of the motion within this part of your back as well, all right? So all Twee's going to do is just to, again, just kind of begin with what she did within the testing position. So she's just going to try to bend her upper back as far as you can over the roller. And once you start to get tight, once you start to get stuck, then just stay right there and just take a couple of nice kind of just shallow breaths, right? Now, there's going to be some level of discomfort or tightness or just even just a slight bit of pain within this middle part of your back if you're doing the stretch for the first time, but that is fine. That is expected. And our goal is to try to help you increase mobility within this area, right? So Tweet here, she's just kind of staying still. She's taking a couple of breaths. Now, in order to help you increase the mobility within this area, what Tweet wants to do here is just take one nice deep breath in, and on her exhale, just try to let gravity just kind of pull her head and pull her neck and just kind of round her back just a little bit further over the roller, right? Until she kind of gets stuck again. All right. Again, just stay there for a couple seconds. Just take a couple of breaths. And once your body starts to get used to the discomfort, once it starts to get used to the stretch, then just take another nice deep breath in, and then exhale, and just again let gravity just kind of pull you a little bit further gently into the stretch like so. All right. And from here, we advise people just to kind of start with just 5 deep breath cycles. Again, don't rush this. Just kind of let your body just get used to the stretch and get used to the motion. And just take a nice deep breath in, exhale, and just kind of let gravity just pull you a little bit further down. All right. Now, if you experience any pain or any extreme discomfort, then obviously don't push all the way down. Just try to just kind of go up to your limits. And again, don't try to push yourself, especially if this is the first time you're doing it. Just try to let this motion come naturally over time. All right. One more deep breath in, breathe out, and just a little bit further towards the ground, and hold it there for 3, 2, 1. Okay. So go and come back up. Now, the next thing you want to do is now to perform the same stretch in the first 4 vertebrae. So Tweed, go ahead and move the roller up your back closer towards your neck like so. Perfect. And from there, she's going to just do the same exact thing. She's going to bend as far back over the roller. And again, she's mimicking as though, she is really tight or really stiff. And just to go as far as you can until you start to feel your body just starts to fight you. Just stay there for a couple seconds. And then when you're ready, take a nice deep breath in, exhale, and just let gravity, again, just kind of slowly and gently guide yourself back down towards the floor as far as your body will let you. Just take a couple breaths there just to let your body get used to it. And then when you're ready, take a nice deep breath in, nice, exhale, and just go a little further down. And just go as far as your body will let you. And let's practice that 3 more times. So another deep breath in, exhale, and go a little further down. Twice more. And down. And one more time. Nice deep breath in and breathe out.
All right. So Tweed's going at a nice pace here, but again, I would recommend that you just go at whatever pace allows your body to feel most comfortable, especially in the beginning. Don't force it. Just try to get used to the stretch, and I promise you that this flexibility will start to improve over time. All right. So Tweed, go and reset. Now let's move down towards the lower third part of the mid back. So just yeah, right there, just below the first starting point that we did. And again, we're just going to do the same thing. So just bend back over the roller as far as you can until you get stuck right about there. Let's hold it there for a couple of seconds and then nice deep breath in, breathe out, and just go a little bit further down towards the ground. All right. Now, just a word of caution when you do this lower one, if you do start to feel a lot of sharp pain in your lower back, or if it just doesn't feel right or feels uncomfortable, then you can kind of skip this lower one and just work on these segments that do feel comfortable. Because sometimes when people are too low, you will start to feel some pain in your back. So if you start feeling pain in your lower back, just move the roller up a little bit higher. That's a sign that you're too low. All right, let's practice 2 more breath cycles. To deep breath in. Nice. And breathe out. A little further down. And one more time. Breathe in and breathe out. 3, 2, 1. Perfect. All right. So that is it for our first actual stretching exercise to help you increase the extension or backward bending of this middle part of your back. Now let's get into the next stretching exercise for today. All right, so the next exercise we want to show you is an exercise known as the cow stretch. So the cow stretch is a very basic exercise where Twee will start on her hands and her knees. And this is one of our favorite ways to help you reinforce the extension or backward bending of the middle part of your back, right? So Twee's going to do, again, she's going to start by on her hands and her knees. And she's going to start by just kind of sinking her chest and sinking her ribs. And the goal is to try to create a backward bending curve across the middle part of her back like so. And again, once you start to feel some type of stretch or some type of, stimulation within the middle part of her back, she'll take a nice deep breath in and breathe out and just kind of sink her chest a little further down. And at the end, just kind of lift up her chest and lift her head just a little bit like so. Again, the goal is to pretend that you are trying to kind of wrap your back around like an imaginary ball that's kind of sitting right here in the middle part of your back. And again, this is just to help reinforce the strength and the activation of the muscles, which will help you retain and to be able to create that motion over time, right? So 3, 2, 1, and go and reset. All right, so let's just demonstrate it a couple more times. So again, she's going to start in a on her hands or knees, and just to start by just kind of sinking her chest and sinking her ribs down towards the mat. Again, you can start to see that backward bending curvature starting to develop right across her entire spine, like so. And then once she starts to feel a stretch, she'll take a nice deep breath in, exhale, and just kind of sink her chest, sink her ribs a little further. And at the end, just kind of stick up her chest just a little bit to really accentuate that backward bending curve that is occurring right across the middle part of her back. All right. Now, when you do this exercise correctly, what you should feel is a little bit of tension, a little bit of activation, or even a slight bit of discomfort right along the muscles that sit right between your shoulder blades, right in the middle part of your back, like so. And if you can really feel those muscles activating or stimulating, that is how you know that you're doing this exercise correctly. And this will help you in a lot of different ways. All right, so Tweet, go ahead and reset. Now, one of the things that I want you to look out for, because this is one of the most common mistakes that I find that people make when they try an exercise like this, especially for those who have a lot of lower back pain combined with a lot of tightness within the middle part of the back, is that when they try to do an exercise like this, something like this will occur where they start to overextend the lower part of their back where all the pressure and all the movement is happening lower, and they're not really focusing on what's happening within the middle part of the back up here, okay? So go ahead and reset. And the reason why this is such a problem is because not only will this, not stretch the area that's actually stiff, but it'll actually create, if you can demonstrate one more time, it'll actually start to create too much pain and too much pressure within this part of the back. And this is the area we're actually trying to relieve pressure off of, okay? So if you start to feel any pain or any pressure within the lower part of your back, just make sure that you reset your form and really concentrate your focus and your effort on sinking across the middle part of your back right between your shoulder blades like so, all right? And this exercise is going to feel way different when you do focus on the middle part of your back. So if you are stiff, if you are weak within this area, I promise you, you will start to feel some level of stimulation and some motion occurring within the middle part of your back. And that is how you know you're doing this exercise correctly. All right. So hold it there for 3, 2, 1. All right, so that is it for the cow exercise or the cow stretch. to help you not only increase the motion within the middle part of your back, but to also teach you how to activate and strengthen some of those very important muscles as well.
All right, so the next part of this video, we want to go over helping you understand the importance of thoracic rotation or twisting of the spine. And before we get into the assessments and the exercise, I just wanted to give you a brief demonstration of what is actually happening within the spine, when you create twisting through this area, and why a lack of the ability to twist within this thoracic area can contribute to causing so many problems within the lower back, right? So it's important to note that the majority of the twisting and the rotation of your spine is actually going to come from this thoracic or this mid-back area. And as you can see here, the way that these vertebrae are oriented is specifically these tiny little set joints in through here. The way that they're angled helps create a very specific glide, which allows twisting and rotation to occur within this part of your back, with relative ease. Okay. But because of the fact that people are very tight or very stiff within this area, a lot of times people will start to lose the ability to generate that twisting and rotation from this middle part of the back. And the reason why this is so important is because if you start to look at the way that the lower back vertebrae are oriented, specifically these tiny little facet joints here, that you will start to see that the lower back vertebrae are not actually very well equipped to create twisting and rotation, because these tiny little joints will actually start to kind of smash into one another, just because, again, the way that the alignment is of these vertebrae, there's just not a lot of twisting or rotation that occurs within these lumbar vertebrae. Okay, so again, if I'm supposed to generate a lot of twisting and rotation within the middle part of the back, so if I'm trying to reach behind me, if I'm trying to do yard work where I'm constantly bending or twisting or rotating or getting things out of the car, or specifically for anybody that plays golf, that just again creates such a rotational demand. If you do not have the ability to create rotation within this middle part of the back, then you will have to find that rotation that will come within the lower part of the back. And if you are generating twisting in an area that just cannot twist, you're just going to start to create a lot of pressure. You're just going to create a lot of just, again, inflammation, because you're just kind of constantly smashing these joints into one another. And that's why a lot of people have a lot of lower back pain, especially when they twist. All right. So what we're going to do is just show you some ways for you to self-assess to see how tight or how stiff you actually are in terms of thoracic rotation. And then we're going to show you some of our favorite ways to help you fix it.
Okay, so what we want to do with this exercise is to show you a very simple self-test that you can perform to check to see how well your body is able to generate this kind of twisting or rotation motion within the middle part of your back, right? So this is an open book stretch or an open book test. So what Twee's going to do is she's going to start to just lie on her side like so, with the pillow just to kind of support her neck. And what she wants to do is just to bring her knees up towards her chest just a little bit more. And what this is going to do, this is going to lock her hips and lock her lower back and her pelvis in place and really help isolate the middle part of the back as she tries to generate that twisting or rotation motion, right? And then what she's going to do with her right hand is to just try to reach all the way across the opposite end of the room, to turn her head and to turn her neck, and to eventually try to see if she can touch her hand and her arm and her shoulder all the way down towards the floor. All right. We'll show it from an angle, but as you probably can't see, but she is able to touch all the way down, which means that this is a passing test. So if you are able to touch and feel no pain or tightness or discomfort, then again, twisting or rotation of the thoracic spine is not a problem that you probably have. Okay, so we go ahead and reset. Now, for people who might lack the twisting or rotation within this part of their body, when they try to create this open book motion, something like this will occur, where as they try to go down, they might start to get stuck, halfway or a third of the way, or sometimes just even 3/4 of the way down. But whatever the case may be, if you cannot touch your hand or your arm all the way down towards the floor, that does usually mean that there is some type of restriction within this middle part of your back that does need to be addressed. Okay, so Tweet, go ahead and close up the book. Now let's just show you what it looks like on the other side, and we definitely recommend that you check both sides, because it's common sometimes to see a person has good ability to twist or bend one way, but they might have a lacking of twisting or rotation the other way. So we want to make sure that you assess both sides like so. Okay. So again, this is kind of what it looks like if you do have a passing test where your hand and sometimes your arm and your shoulder should be easily able to touch the floor through here. And again, if you are able to touch and feel no pain or tightness or discomfort, that is a passing test, and thoracic rotation is probably not a problem that you actually need to be focusing on. All right. So, Tweet, go ahead and close up the book. And again, just show you what it looks like if you are, stiff or tight within this area. As you try to create that twisting and rotation, you just won't be able to go as far down. Your arm will get stuck. You might feel some tightness across the middle part of your back. And again, if you aren't able to get all the way down, again, that is fine. It's just it's good for us to acknowledge that that is the problem, and that is something that we do want to help you address. Okay, so Tweet, go ahead and reset. All right, so that is it for the open book rotational test. Now let's help you get into some of our favorite correctives to help you increase thoracic rotation next. All right, so now that we've gone over the open book test to see how well you're able to generate twisting rotation in the thoracic spine, now I just want to show you an open book stretch. So the stretch is just kind of based right off of the test, similar to the foam roller extension, where Twee's going to lie on her side. And she's going to be doing her left side. She'll be facing the wall. And again, we're going to assume that you are stiff or you are tight within this area. So we just want to walk you through the finer elements of the form and technique in order to make sure that you do the stretch correctly. All right. So again, try to, again, just perform the open book, just like we showed you in the testing position. And once you get tight, once you get stuck, once you start to feel some tightness or some stiffness, then stay right there and just take a couple of nice shallow breaths. Just let your body get used to the position. And once you start to feel you are ready, then take a deep breath in, and on your exhale, just try to go a little bit further towards the floor, just as far as your body feels comfortable taking you. Right. And then once you get into that new position, just stay there for just a little bit. Just try to control your breathing. It's common where you might start to feel your breath start to shallow. You might feel some discomfort. Just that's okay. Just give your body a chance to adapt to the new position. Just stay there. And when you are ready, once things start to calm down, take a nice deep breath in, exhale, and just try to gently push yourself a little bit further towards the floor like so. Again, we want to repeat this about 5 times. So just kind of 5 cycles of this, breathing in and breathing out. And don't force anything, don't rush anything. Just let your body go as it is, comfortable and able to. Right. Again, if this is the first day, if you have a lot of tightness, again, just work to your limits. Don't try to force it. Just work within your body's own comfortable level. And once you get used to this stretch, then you will start to be able to get more comfortable getting deeper and deeper into the stretch. All right. So deep breath in, exhale, and just go as far as you can towards the floor and hold it there for 3, 2, 1. Okay, so that is it for the open book stretch. I absolutely recommend that you perform this on the other side as well. But let's get into the next exercise for today. All right, so the next corrective exercise we want to show you to help you improve your rotation of the middle part of your back is known as the reach back exercise. Right, so Twee's going to start by just kind of sitting on her hands and on her knees, and just kind of sitting her hips all the way down towards her heels to start. All right, and she's going to start with this exercise by putting her right hand behind her head, and then her left hand is going to go right in the center, right between both of her knees, just to kind of anchor her hands right in the middle there. And what she's going to do from here is to try to slowly point her elbow all the way up towards the ceiling and letting her neck and her eyes and her head follow suit as well. And again, just try to point her elbow all the way towards her ceiling like so. And just hold it there for a couple of breaths. 3, 2, 1, come back down and resets. Right now, since she is quite mobile within this area, she's able to get her elbow to touch the ceiling, with relative ease. But for a lot of people, when they perform this exercise, go ahead and demonstrate, they're only able to get about, halfway up like so. Right, so it's important just for you to just create as much twisting as you can, and just to get to your limit. But once you hit your limit of where you just start to feel a lot of resistance or tightness, then just try to stay there and just try to take a couple of breaths. And when you feel like your body is getting used to this position, then take a nice deep breath in. And on your exhale, again, just try to drive a little bit further into the stretch like so, and then try to hold it there for about 5 seconds. Right. Again, want to go through about 5 cycles of this just to get the maximum benefit of doing the exercise. And again, just try to slowly inch your shoulders and slowly inch your elbow, and just really try to increase the twisting part of that middle part of your back just as far as you can. And hold it there for 3, 2, 1. Good. And come back down. And let's demonstrate one more time on the other side, right? So now she's going to be putting her right hand flat on the mat, and then she's going to try to point her left elbow all the way up towards the ceiling, creating that nice twisting and rotation right across the middle part of her back. Again, she is quite flexible, she is quite mobile, so this exercise is relatively easy for her. All right, so again, go ahead and reset. But if you are really tight within this area, it might look something like this, where if you try to go as far as you can, you might start to get stuck. So again, just stay right there, take a couple of breaths, just give your body a couple of seconds just to get used to it. And then when you're ready to just try to push yourself into a deeper stretch, take a nice deep breath in, exhale, and just use your exhale just to kind of push and drive into a deeper stretch like so. Perfect. And hold it there for 3, 2, 1, and reset. All right. Now, there are some people who, when they do this stretch, might start to feel some tightness on the top of their shoulder if they are really tight within this area. So, if that's happening to you, if you just are experiencing some discomfort on your shoulder, then you can also perform this exercise by putting your hand behind your back, like so. And again, also make sure that your shoulder isn't kind of slumping or rounding forward. So really make sure that you're trying to really get your shoulder blade to come back. So go and demonstrate to me as you try to extend and rotate as far as you can towards the ceiling, right? And then same thing, just go as far as you can. You give your body a chance to adjust and let it get used to the stretch. And when you're ready to advance, take a nice deep breath in, exhale, and just push as far as you can and hold it there for a couple seconds. 3, 2, 1. Perfect. Now let's show one more time on the left side, hand behind back. All right. So left hand behind back. And just to try to twist and rotate as far as you can. And you should feel a bunch of stimulation right across the center or the middle part of your back. You might feel some muscle activation along your ribs or along your sides. That is completely fine. If you experience any pain in your lower back, if you start to feel a lot of neck or a lot of shoulder pain, then just kind of back off from the stretch. Don't force this one. This one is way harder than it looks, especially if you are really stiff or really weak with this area. But again, it is one of the most effective ways to help you start to restore the motion, restore the strength within this middle part of your back, which I promise, will help take a ton of pressure off of your lower back if you do these exercises correctly. All right. So hold it there. 3, 2, 1, and go ahead and reset. All right, so that is it for the reach back exercises. So that is it for this routine. All right, so the last exercise that we're going to show you today is an exercise known as an isometric deadlift. This is also known as a hip hinge exercise. And this is one of my favorite exercises because of how safe and how simple this exercise is, but also how effective it is at really teaching you how to activate and strengthen some of the most important muscle groups that will help you eliminate chronic back pain for good. All right. So what Twee's going to do here is she's going to start by just kind of sliding her hands down towards her knees. And it's important to note that we want her to start with her back in this kind of rounded or kind of, hyperkyphosis position, because this is going to mimic that kind of, again, rounded shoulder posture that a lot of people find themselves in nowadays, with their upper back is kind of stuck in that kind of forward bent position. All right. So the most important part about this exercise is that once we have established the fact that she has adequate range of motion and mobility that we taught you in the first couple of modules, is that we want to teach you how to now activate those muscles to help you take your back from a rounded position into a nice straight position like so. All right. So as you can see here, if I draw a straight line from the back of her neck all the way down towards her lower back, you should see that her back is in one nice straight line like so, right? And this is a position that is known as a neutral spine. And this is the most safest, the most secure, and the most stable position that your back can be in. And most importantly, this is also how we know that you are activating and stabilizing all of those very important muscle groups that a lot of people just do not have access to. All right. So go ahead and stand up now. All right. And reset. All right, now let's just practice that a couple more times. All right, so again, just starting by sliding her hands down towards your knees and starting with her back in a rounded shoulder or a rounded position like so, and just kind of slowly taking her back into a nice straight line and really focusing a lot of her effort on that mid back area to make sure that she is creating that kind of straight line effect across her entire back. Okay, you want to hold that position for just about 5 to 10 seconds. Hold it there nice and tight. And then from there, go ahead and put your hands back behind your back like so. And then go ahead and stand up nice and slow. And just make sure you stand up nice and straight, tight glutes, tight abs, shoulders back. and make sure that your posture is in a nice upright position like so. All right. Now, a very important thing to note is, especially for people who are just starting this exercise, for people who are very stiff or very weak in their mid back, is that when they try to do this exercise in the beginning, they may have a tendency to want to overarch from their lower back like so. Right. So if you start to feel a lot of pressure in your lower back, if you just can't quite get your upper back to kind of lock into that kind of straight line position, just go ahead and reset the exercise and make sure that you are focusing all of your effort and your energy on trying to feel all that kind of motion occurring and all that activation occurring right between your shoulder blades in that mid back area like so. Okay. So again, hold that there for about 5 seconds. 4, 3, 2, 1. Bring your arms back behind your back and go and stand up nice and slow, all the way nice and straight. Tight glutes, tight abs, shoulders back, chest out. Hold it there for 3, 2, 1. All right, so that is it for our mid-back mobility and strengthening rehab module to help you fix some of the underlying causes of chronic back pain. I hope that this helps, and we hope to see you again next time. Take care and have a wonderful day.